I'm going to introduce Severine Frison, who is the nutritional epidemiologist. I'm sure they have more than one at Epicentre, which is the MSF Research Center in Paris. Before joining Epicentre, Severine has worked both in the humanitarian aid sector as well as in academia. So she worked for 5 years in Africa and Asia with a variety of humanitarian organizations, including WFP, Action Against Hunger, and UNICEF, and spent 4 years recently at the London School of Hygiene and Tropical Medicine, where she was the co-author alongside Carl Blanchette and others of the recent paper on mapping evidence against the 2011 sphere standards, as well as a new article that has just been published last month in The Lancet on evidence and public health interventions in humanitarian crises. So we're going to hear from Severine on what these studies, this research that she has carried out, have to say about the mapping or the overlap between evidence and the 2011 Sphere Handbook. Over to you, Severine.
So thank you very much. Hello to everybody. I'll be presenting a piece of work I did last year with Carl Blanchette at the London School of Hygiene and Tropical Medicine, looking at evidence supporting the Sphere standards. So as a bit of background, there's been an increased shift and an increased willingness to have more evidence-based intervention in humanitarian action. And as part of that, the London School of Hygiene and Tropical Medicine has been collaborating with Enhancing Learning and Research for Humanitarian Assistance, ELRA, since 2013. So back then, ELRA commissioned the London School of Hygiene and Tropical Medicine a review that addresses the evidence on health intervention and in humanitarian crisis. And that's the piece that was just recently published in The Lancet, as Alice mentioned. Moving on to what's happening now. So as the Sphere project is embarking now on the 4th revision of the handbook, ELRA and LSHTM, in collaboration with the Sphere handbook, the Sphere project, excuse me, have been working together to look at how much evidence there is that is supporting the Sphere standards in order to inform as well as possible the 4th revision of the Sphere handbook. So this study was part of a wider project where we did a survey looking at the use and the knowledge of the Sphere handbook, expert interviews, and the classification of indicators as using the SMART criteria. The SMART criteria stand for specific, measurable, attainable, relevant, and time-bound. But today I'm presenting specifically on the evidence bit. So the objective was to review evidence generated by the LSHTM review and identify studies that could support the Sphere standards and indicators. To do so, we assessed and matched all the studies from the LSHTM review to see whether they could support any of the standards and indicators from 3 different chapters, and these were water, sanitation and hygiene, so WASH, food security and nutrition, and health action. For the health action chapter, we only focus on the essential health services, and we did not include health systems. So the LSHTM review included 6 studies in WASH, 77 in nutrition, and 236 studies on health action. As you can tell on this table, there's very few of these studies that actually provided evidence for the Sphere standards and indicators. The WASH chapter from the Sphere handbook contains 13 minimum standards and 58 indicators, and out of the 6 studies that were included in the review from the London School, 4 studies support 3 indicators and 3 standards. All of these studies actually showed statistically significant association between intervention and the health outcome. All of these studies had diarrhea as health outcome. Although these studies provided some evidence towards these indicators, they didn't fully support the indicator. What I mean by that is that, for example, we had a study showing the positive impact on health outcome, so on diarrhea, of providing buckets, but that study did not specify the size of the bucket or the number of buckets. Moving on to the food security and nutrition chapter. That one contains, it contained in 2011 18 minimum standards and 63 indicators. And out of the 77 studies on nutrition included in the review, 8 provided evidence to 7 indicators and 5 of the standards. Yes. Out of these 8 studies, 7 of them were showing statistically significant associations between the intervention and the health outcome. Similarly to the WASH in the studies supporting the indicators, they only supported part of the indicator and not necessarily the full specification of the indicators. Moving on now to health action, that contained 17 minimum standards and 38 indicators, and that's again only looking at essential health services. Out of the 236 studies included in the review, 21 supported to some extent 4 indicators and 3 standards from the health action chapter. Out of these 21 studies, 12 measured statistically significant associations between the intervention and the health outcome. So as you can see here, we had 4 indicators in the health action that had some form of evidence from these 21 studies, and out of these 4, 2 of them, for example, were indicators on coverage of specific vaccines. And to give you an idea of the kind of evidence that we found for these indicators in particular, we found evidence that was looking at the benefit of vaccination campaigns as a whole, but without going into the details of the coverage to be reached. So we did include these studies as providing some form of evidence for these indicators, although they didn't specify, again, entirely the indicator from the SPHERE project, the SPHERE handbook, sorry. So now moving on to the key recommendations. As we saw, there is limited evidence from the LSHTM review from 2013 that actually support the SPHERE standards and indicators. But one thing that I think is important is to be more transparent as to where these standards come from, how were they formulated, what were they based on. And I think they should be linked to peer-reviewed studies, guidelines, other documents. It doesn't necessarily have to be peer-reviewed publication. It doesn't necessarily have to be RCTs or anything like that. I think expert consensus, I think key recommendations from expert meetings, and even sometimes common sense can be good sources, but I think it's good to be clear as to what are the sources for these standards and indicators. And then finally, we do believe that it's probably better to define priority standards and fewer priority standards per topic, and really well define them, really fully explain the sources, and possibly for the other standards and indicators where it's not possible to have the same kind of level of information and evidence behind, maybe have them more as principles or guidance note, but maybe not as indicators or standards. So that was all for me. Thank you very much.
Great, thank you so much, Seven. Really interesting. Just a quick follow-up question for you to clarify. It sounds like in your study you found some pretty significant gaps in the connection between the evidence base and then the SPHERE standards. I was wondering, were there any examples you found where the evidence available or the studies that you looked at were actually in direct contradiction to a standard that was, or an indicator that was stated in the handbook, or was it really a matter of kind of gaps that you were identifying?
No, yeah, it was really more about gaps and, yeah, lack of links to other. I mean, there's a lot of annexes and guidance note and all that, as you know, but it was more, yeah, a gap of evidence.
Okay, and just coming in with one more quick follow-up question that's coming in online from one of our participants was why you decided not to include other systematic reviews, such as reviews from Cochrane. You were using or including only kind of original studies themselves, if I understand that question correctly, and not including other syntheses. So can you explain perhaps that decision?
Oh, that was decided between our DFID, the Wellcome Trust, because that review was done for the DFID, the Wellcome Trust. And so that's a decision and a discussion that unfortunately I wasn't part of. I was only in charge of, sorry, I think I got confused. Are we talking about the review from the LSHGM or this piece of work? We only reviewed from the LSHTM because the team I was working with, we had been part of that review, so it was the easiest thing to do with the time limits that we had.
Right,
But
right.
as I think I mentioned briefly in the introduction, that this work was complemented by expert interviews and then a survey and that indicated classification. And part of what we did with the interviewing experts is also asking and compiling all the references in terms of guidelines, reviews, and all the main documents that they find is crucial. And so we did look at that as well, but not in the particular study that I was presenting today. That was included, but more in the other bits. I'm not sure I'm
Great,
answering
thank
the
you so
question.
much. No, you are absolutely. That's really clear, and so important that you included that expert consultation angle for or that additional component in the report. Thank you so much.